Good night. Well, good evening, ladies. My name is Kendra Mickens. I'm on a team with Miss Ebony Bostick and also Miss Beverly Brock. And we are going to be talking to you about Mr. Jim Mueller and his episode in our ER. I'm going to be playing the doctor today, and Miss Ebony is going to be the RN, and Miss Beverly is going to be our pharmacist. And she is going to start off tonight talking about Mr. Mueller and what occurred.
Good evening. We're talking about Jim Mueller. He's an 83-year-old man. He is at a family picnic drinking soda out of a can when he swallows some soda and realizes a bee was in the soda can before because he feels it sting him in the throat. Jim has a history of allergies to bee stings. His wife rushes him to the emergency room. Data obtained from the nursing assessment on admission to the ER. It is as follows. His vital signs: pulse is 100, respiration is 24, and shallow. Blood pressure 88/58. He has dyspnea. Lung sounds are barely audible at the bases. He's cyanotic at the fingertips and his lips. Pale, cool skin. His pulse ox is 88. He has a history of hypertension and he is on propranolol, 40 milligrams, POBID. He started on epinephrine, 0.3 milligrams of a 1 to 1,000 solution sub-Q every 20 minutes until his blood pressure stabilizes and respiratory stress is no longer evident. And the first question was, why is Mr. Mueller on this medication? First of all, we want to get his blood pressure within normal limits and also get the respiratory distress subdued. We want to make sure that he has a therapeutic effect of the medication, and this medication is a adrenergic agonist, and it works on the beta 2 receptor cell, and it causes vasodilation. So that's what we're aiming at, getting him vasodilated so we can get him within normal limits.
Hello. Yes, Mr. Jim has a history of hypertension, so he's on propranolol. He is on epinephrine to counteract the allergic symptoms due to the bee sting he received while drinking a soda. So we're going to watch those symptoms from the nurse.
Okay, and from a doctor's standpoint, explaining to Mr. Mueller and his wife why this medication would have been ordered. Actually, our pharmacist touched on some of those reasons. Mr. Mueller is having an anaphylactic reaction to being stung by the bee, and one of the reasons why epinephrine is ordered is because it is a vasopressor, which will assist in raising his blood pressure, which is extremely low right now. And it is also a bronchodilator, which will help him with his breathing so that we can get his respiratory status improved and also improve his O2 saturations. And looking at some of the patient variables in dealing with Mr. Mueller, certain variables that I will look at would be his health status, his lifespan, and then also his habits. At this point in the ER, I don't have as much information on his habits. For his health status right now, I'm dealing with the fact that he's in the middle of an anaphylactic reaction. Again, his vital signs aren't as good as we would like them to be, which is why we started him on the epinephrine. And also, I have to take in consideration his history and his health status with the fact that he already suffers from hypertension and is taking medication, propranolol, for that, although that is not his issue at this time as his blood pressure is extremely low. In lifespan, although he is a little old, again, you can look at things that he can take, and in an anaphylactic reaction, epinephrine is appropriate. And then regarding his habits, I'll talk to him more and see if he's at risk of polypharmacy. So I will know about any other medications that he takes other than propranolol that may affect the epinephrine. And then we're going to have our pharmacist talk to us more about patient variables. Beverly?
Okay, and what I'm going to be doing is just making sure that he doesn't have, that he's getting therapeutic effects from the medication, and we'll be looking to see what else he's taking. And as she says, we noticed that he's taking the propranolol, so we're going to have to make sure that we send an order to temporarily discontinue or hold that medication while we're giving the epinephrine. They can't be given at the same time, but we're wanting to make sure that he gets the therapeutic dose, and once the therapeutic dose is achieved, he should go back into have normal breathing, and his SAT should reach a normal level, and blood pressure should be stabilized.
Okay, and so for the patient's core patient variables from this end is I will take his patient history, medication history, due to the fact that there may be some interactions with the epinephrine. Also, we'll have baseline vitals for him, a physical assessment for him, and also manage or monitor sensitivity, if you have sensitivity to the epinephrine. And so for I'm sorry, for the nursing assessments that will demonstrate the effectiveness of the drug therapy, what I will watch for is the resolution of the symptoms being solved, a resolution of the symptoms, I'm sorry, and a decrease in the heart rate, increase in the blood pressure to within normal limits, and I want to monitor his respirations to make sure he is at a stable environment with his respirations, and making sure he's just breathing normally, and that's it.
And my question was, what actions are indicated to maximize the therapeutic effects? We want to make sure that he gets it every 20 minutes, and to ensure that his blood pressure goes within the normal limits, and also that he reestablishes a normal breathing pattern, and that he's able to metabolize the drug, because it is metabolized in the liver and excreted in the kidney. So we want to make sure that they are watching his kidney function.
All right, and then discussing things that I, as the doctor, would do to minimize his adverse reactions or his adverse effects of the medication. Some of the things I would do is make sure that frequent vital signs are ordered. Make sure that we are definitely assessing his blood pressure, since he already had an issue with chronic hypertension and possibly took his propranolol that morning. He takes it twice a day, and there's a good chance there could be some slight interaction with the epinephrine. So we do want to closely monitor his blood pressure. Then also, because of the risk of cardiovascular effects, I would want to get an EKG ordered just to monitor it, to see if it's having any effects on his heart. Also, we could order some lab work just to make sure that his kidney function is okay. As Beverly pointed out as the pharmacist, this is a medication that will still have to be excreted in his kidney, so we want to make sure that he's not having any kidney issues that I may not be aware of. Also, we want to make sure that when we look at the epinephrine, it is going to address some of his breathing issues, and it will hopefully address and bring up his blood pressure, but it's not really listed as a antihistamine. There are still antihistamines that could be ordered to stop the histamine effect that he's having right now. Also, depending on how well he does with getting the epinephrine every 20 minutes. He's only getting it until those vital signs are improved, so he's not going to get excessive amounts of the medication. As soon as we start to see if there are some improvements, we're not going to give him additional epinephrine. Also, we know that the epinephrine only lasts for about 1 to 4 hours, so again, he's going to need continuous monitoring to see how he does as he rebounds off of the medication. So again, we're going to stop it as soon as we see the turn with his blood pressure increasing, his respirations coming down, yet having his O2 saturation improve. He may need some actual oxygen supplementation until that time, since his O2 saturation is only 88% at this time. So those are things that I will look into. He also may need some IV fluids at this time, just to kind of help manage any potential adverse effects. So those are things I would do in addition to what Beverly said. Excuse me. We'll make sure that propranolol is held, because he is at risk for rebound hypertension, and he could also experience reflex bradycardia, which is another reason why we'll want to keep a good eye on his heart rate. And going to teaching for Jim and his wife, some of the things we want to do in preparing him for once he is able to go home, because hopefully he won't have to be admitted. We'll be able to get this anaphylactic reaction under control. But we would want to give him some written instructions. I would definitely want him to follow up with his primary care physician. It looks like in this situation he had to be rushed to the ER because he didn't have an epinephrine pen. EpiPens are things that he is definitely a candidate for because in his history it says that it was a known allergy before. And we know that this is something that he could have an even worse reaction to in the future. And if this was his reaction this time, there's a potential that he won't have enough time to get to the hospital in the future without getting the EpiPen on him and getting that used and initiated immediately. Again, we need to let him know about the possible adverse effects and that even if he does have an EpiPen in the future, he'll definitely need to follow up with the ER, even if he uses an EpiPen, and he'll probably need at least two. And then again, he will follow those directions, and he can give himself a second dose if needed at that time. But 100% with an EpiPen, follow up with the ER each and every time. And also, we need to find out more information about his medications. So make sure that he does not suffer from polypharmacy. Make sure that there aren't any over-the-counter medications that he forgot to tell us about, although we were told about the propranolol that he was on. But again, also making sure that he follows up with the primary to make sure that everything's okay and see if there are any changes that need to be made to his medications and see if there are any additions. And I will actually throw it to our lovely nurse, Miss Ebony.
Absolutely. So from a nursing standpoint, I would definitely include teaching that is brief and basic, kind of in a layman's term for the wife and the patient here. So I will basically teach on the possible side effects associated with the EpiPen or the Epi drug, the importance of avoiding over-the-counter medications because of the interactions that could occur there. Additional data for teaching could be handout given to the patient talking about the actual anaphylactic allergic reaction that he had and the epinephrine pen highlighting the adverse reactions and what symptoms to look for while at home. And I'll go ahead and get my pharmacy to further explain some teaching points for the patient.
I would talk to him and his wife upon him being discharged and let him know that the anaphylactic response is unpredictable, that he could be stung by a bee at any time, and he needs to make sure that he does have the pens with him at all times. And I'd also want to educate his wife on proper injection sites. That's one thing that a lot of patients are not aware of, where the injection is supposed to be, the injection site, and need to make them aware that these pens do not last forever, that they have to be renewed. They have to go into the doctor to get the prescription renewed because they do have an expiration date. And I would also let them know that they have to be very careful when they're outside. And you know, bees are something that we can't predict when they are and where they're going to come out, but we have to let them be aware of, to let the people in the area around them, and also teach another family member how to use the pen because his reaction could warrant death.
All right. Well, this was our presentation in dealing with Mr. Mueller and his anaphylactic reaction with a bee sting. I hope you ladies enjoyed. Thank you.